Good morning. Welcome to the Safety Committee meeting. We'll start off with, do we have any public comments?
Yes, Omar Vera is our single public speaker this morning.
Good morning, Omar.
Good morning, MTA Safety Committee. It's my first time speaking at this particular meeting. So I'm going to try to be brief, but get to the point. Now, Monday, you all heard about what happened near the Port Authority bus terminal area, right? What happened? Yeah. I heard from my friend Jason that you were at the scene shortly afterwards, Mr. Chairman. But,
just one correction. It happened in the New York City subway system.
Oh, I'm sorry. But I just want to be cautious with like everything. My bad. Sorry. All right. So, like I said, I appreciate the campaign that y'all been doing like over the course of over a decade. You know, if you see something, say something. That announcement. Although I do like it when conductors try to switch the words around a little bit to not be like, you know, to be so like sound like monotones. But okay. But yes, the MTA like we should always be working to improve you know, on safety. I mean, I myself like. You know what I started to do now? Every time I come to like any one of these meetings, like monthly, I now accompany a friend of mine like in the early morning to 14th Street before going here. And in case you're wondering, I have spoken about her on Monday, and I've spoken about her in a number of previous meetings. And Andrew, you know who I'm talking about. You haven't met her, but you know who I'm talking about. I gave you that letter back in March, and she's mentioned there. Initials. But in any case, so just keep coordinating with each other, and eventually we'll make the city a better place, a safer place, because we do not want to go back to the bad old days, the 70s, 80s, and even early 90s, because we've come a long way, but we can always do better, because, as you know, nobody's perfect. With that, I'll hand over the floor to all of you. Thanks.
Thank you very much. There are no further public comments. We'll move over to the meeting for the approval of the minutes from our meeting on September 27th. I'll move the minutes. Second. Are there any edits or comments? There being none, all in favor say aye. And the motion carries. Now, the draft committee work plan.
The work plan, so we've included a work plan in the committee book for calendar year 2018. As we did during the last couple of years, it follows the four principles of safety management. And if, certainly offline, I would invite any of the committee members to send any suggestions they would want, because those principles are fairly general, and it allows us the opportunity to make sure that we're responsive to your interests and your needs. So let us know if you have any topics you would like us to address in the coming year. Just to mention that the Safety Committee charter is repeated again in this month's book, and again that's advanced from the Governance Committee to the full board, but it's there for information. If anyone has suggestions or ideas, again, you can please pass them along.
Right, and as mentioned at the Governance Committee, that work will continue into at least the January meeting, if not beyond that, but it'll be an ongoing topic. Okay. On to the report regarding safety metrics.
So for safety metrics this month, we don't have a specific report, but the metrics are all in your books. They are repeated from the Monday operating committee books, and if anyone has any questions or comments, we certainly have an opportunity to respond to them.
Anything?
My discussion of the grade crossing increase until we get to the grade crossing report. I think it's a much better place to have that conversation.
Agreed. Thank you.
Thank you.
Okay.
We're moving through this rather quickly. We expect it to be really compressed for time, but that'll give more opportunity for questions and discussions. Item 6 has a few different items in there that we can talk about. They're all PowerPoint slides for them, and the first one kind of follows up on a topic from prior meetings on deep station egress. So that's Cheryl Kennedy with New York City Transit.
Cheryl?
Okay. Good morning. This is a follow-up to previous questions that we had regarding elevator access and emergency egress at our 168th Street station on the number 1 line. We verified that there are 3 stations where the primary means of entry and exit are by elevator, 168th Street and 181st Street stations on the number 1 line in Manhattan, Clark Street Station on the 2 and 3 lines in Brooklyn. All 3 stations have emergency stairs for fire department emergency access and customer egress. 168th Street has 1 stairway that requires major structural work, which is in the capital program and will begin the same time as the elevator work this coming year. Procedures are in place which include the use of emergency ventilation fans if necessary, the removal of customers from the platform by train if necessary, and there's another stairway in the station. 181st Street has 2 emergency stairs, and Clark Street has 1 located between the elevators. There are 4 elevators at 168th Street and 181st Street stations and 3 at Clark Street Station. In August, subways began to replace or repair various elevator components at 168th Street and 181st Street, which in the past contributed to unreliable service. Beginning in August, elevator and escalator maintainers were stationed at 168th Street during the AM and PM rush hours to respond to elevator issues at 168th Street and 181st Street stations. A contract has been awarded and began on Monday for a vendor to perform maintenance, repair, and emergency response at 168th Street and 181st Street stations. The emergency stairs are inspected daily, and a bulletin was recently issued to clearly restate that expectation and to provide a checklist of conditions to look for. Emergency stair signage was verified, and it should be noted that emergency ventilation fans are available at all 3 stations in the event of a fire. This enables us to move smoke away from customers. The Rail Control Center has developed procedures to better handle overcrowding at stations with connections when there's a stoppage in service. This next slide, I'm waiting. Well, we're stuck. Okay, here we go. Okay, this slide shows the signage identifying the emergency stair on the southbound platform at 168th Street on the left side. On the right side is directional exit signs to the elevator and emergency stairs visible from the station platform. So that's just a photo from 168th Street. So that concludes the presentation.
I just have one question. Are you comfortable that the signs pointing to the emergency exit are sufficiently illuminated in the event of a problem? If you are, I'm fine with that, but please do take a look at the illumination aspect, because if the lights go out, the electricity goes out, whatever, just a painted sign is probably not enough. All right?
Okay.
Thank you.
Yeah, I went there. No, I went there with the congressman. Okay, further, yes, Andrew?
As 191st Street on the 1 is the deepest station in the entire system, why isn't that part of this presentation, out of curiosity?
That also, that has stairways for customers to use. We were identifying stations that primarily was using an escalator, and there really is not stairways available. So that's why.
Okay, thank you.
So thank you. Thank you very much. The next topic we want to cover is grade crossing safety, and Kirsch is going to talk a little bit about a very specific project that we've been running just starting a couple of weeks ago.
Ann?
Thank you. So we decided to talk about some technology that we've been introducing at a few of our grade crossings on both the Long Island Railroad and Metro-North Railroad territory, to introduce technology really to address a specific problem that we've identified, which is motorist queuing back onto the railroad tracks. So we identified, using one of our consultants, some technology, off-the-shelf technology that we combined into a really first-of-the-kind usage of this system. we've called it the Active Stopped on Tracks Warning System, or ASTW. So it's really a traffic control device providing visual and audible messaging to motorists. It was designed to address, again, the specific concern of the motorist queuing back onto the grade crossings. The system is comprised of an audible device, a changeable message system, a sign that changes the message, vehicle detection, and a control system and power supply in case there is a power failure. Next slide. Yeah, thank you. The four locations identified are Virginia Road on Metro North Territory, Roaring Brook Road on Metro North Territory, Pulaski Road, and Wellwood Avenue, both on Long Island. And these particular crossings were identified as are heavy traffic areas. We've noticed that motorists in the area back up from either a traffic light, other roadways, intersections, and they're just queuing onto the tracks and potentially fouling or actually being on the tracks, creating concerns. So this technology itself, we're identifying, part of the test is really to look at different technologies, radar detection and loop detection, to identify when a vehicle is within a particular area, and we'll show you where that is. And then the changeable message sign itself and audio messaging. The system is designed to activate by the vehicle detection, which is why it's a traffic control device and not a grade crossing device. The changeable message sign comes on when the vehicle is detected, and then an audio message as well will then reiterate the message. So the message will actually say, warning, get off tracks, and the audible will say the same.
So many cars in the queue before the last one is on the tracks, correct?
Depending on the location, yes, but ultimately a car ends up on the tracks. However it ends up there, whether it's in a queue or it just happens to stop there or get stuck there, it will hear the same message if it's there for about 4 seconds. So we're really looking at the technologies. We're going to see whether or not we can introduce modification of motorist behavior. That's what this is really designed to do, change the motorist behavior. They're so used to following a car in front of them that they just end up on tracks, and we really want them to understand where they are and that there is a hazard in front of them. So this system hopefully will introduce this, as you'll see, and I'll just point out a few things before we show a short video. You'll see some of the things that we've tried to introduce into grade crossings. These white poles along here, oh, thank you. These white poles along here are delineators, they're traffic delineators, and they actually channelize cars so that they can't turn onto the railroad tracks, and they understand that that's the lane of traffic. So you'll see that on both sides and moving across and through the crossing, as well as the roadway lines, the pavement markings traveling through, again to identify that that's the lane of travel. Some signage that don't block the box, and the box is actually painted on the roadway. This one in particular has been discussed before. It's painted in red. As you see, that's not really the intention, but this was done just for test, and we are looking to see whether or not it does change motorist behavior at all. Most of the boxes that you'll see out there at these locations and a few others will be painted X's in white. So the signs say don't block the box, and then you'll see in the forefront here the changeable message sign, and that will illuminate in the video, and you'll see that there's radar detection at this location, and the audible, there's a horn here. I think it's hiding behind the gate arm, and then a video camera. So if you could start the video. And this was a test before we actually introduced the system. So is the volume up? Yeah, in this particular situation, this was a test. We've got foul time on the tracks, and it's a company vehicle sitting on the tracks. Unfortunately, the audio is not working, which was really the intent of this particular video. So at this point, we've activated the the gate arms to simulate a train coming. So this message actually changes from warning, get off tracks. The message escalates as a train approaches, and it says, get off tracks, train coming. And then the motorist will actually hear that message as well as see it in front of them. Okay. If you can go to the next one. So this was a test. This now is actually real world. This is Pulaski Road in Huntington. If you can start that video. This does not have audio, because this is coming from the system itself. And this really is showing you what we're talking about, the queuing onto the tracks. That black minivan there is queuing. The message illuminated and the audio played, and that driver actually responded to the message to get off tracks. And so you saw that driver go around the line of traffic and move out of the way. Okay, next. So, yeah, next slide. Thank you. So that's really just some of the technology that we've introduced. We'll be testing that to see some of those components and how well they actually do impact motorist behavior. We'll be testing it for a while, let the system work for a while, and then come back in about 6 months, look at it hard again, and see whether or not that the impact that we think it's having continues to play out and people aren't just getting used to it.
Okay. Mitch?
Mr. Chairman, thank you, Mr. Chairman. I assume the intent here is to make sure that the next car in line, which is the queued car, does not go onto the tracks without the ability to get off the tracks, to get to the other side, for lack of a better term, in that regard. So the question is twofold. Obviously, we have many places on Long Island, and I'm sure in the Metro-North territory, where the traffic light for the roadway going the same way is very close to the rail crossing. Unfortunately, it is, but it is. And so the ability of that traffic light to control the traffic across the crossing is really the issue. And have we looked at in any way doing something with that traffic light in either in these areas or in other areas to somehow reduce the possibility that the car will get stuck on the track or stop on the track? It's not really stuck, it just stopped.
Stopping in that location.
Right.
Yes, so part of the overall effort with our grade crossing consultant, as well as New York State DOT, the local municipalities, and obviously the railroads and their signal personnel, is to look at those locations. We're really doing a comprehensive review of grade crossings throughout the territory on MTA properties, and looking at ways to improve those issues. Some are design issues, controller issues with the traffic signal itself, looking at other technologies that might need to be introduced, a queue cutter that might identify when traffic is backing up and sends a signal to the traffic light that it needs to turn before other other cars queue onto the roadway.
Now, obviously, in some places, the traffic light is coordinated with the train. Deer Park being a perfect example of that, because you can't get to the parking lot without going across.
Right.
You know, I'm not arguing whoever designed that should be fired, but I'm sure that person is long gone by now. But it does lead to, yeah, I'm sure that's probably true, but it does lead to significant traffic control issues, and I'm sure Deer Park is not the only place, I know what happens in other places, to try and coordinate the traffic light access point with the train itself. How do we illuminate that issue?
Yeah. You want to? Sure.
So, Mitch, we've had a long-standing relationship with a lot of our municipalities to install preemption at crossings. Preemption is a deliberate technology to coordinate the lights with the activation of the crossing gate. And we actually have well over 50, if not 60, grade crossings that have this preemption technology in place. Layered onto that, during our monthly signal inspections, as part of their FRA testing, in addition to doing the FRA testing, our signal forces actually activate the preemption and make sure that the preemption is continuing to work and functioning as intended, and giving the opportunity for cars to leave the intersection in conjunction with the approach of a train. So we're very conscious of how important that is to ensuring that we're not creating a trap for folks and getting them onto the crossings, but also looking to expand that as we move forward with the crossing. So that's another layer of technology that Long Island has actively pursued for quite some time.
Is there any way with this technology to somehow get a signal to the train operator that there is a car on the track in the wrong place, or something in that regard?
So that's a long time off before something like that. Lots of vendors come to us all the time asking to introduce that kind of technology, but you'd literally be stopping trains all the time because you'd be detecting vehicles on the tracks in those areas, and the timing is very important. So,
right.
So what message are you really sending to a locomotive engineer or a control center when you're sending a constant signal that there's something on the tracks? Certainly, visibility is important for those issues, but a signal to a locomotive engineer, their only choice is to stop.
Right.
Right. So you'd be stopping.
If they're within a limited area to the crossing, obviously the issue is going to be how close that's going to be in that regard to ensure that the train operator could stop the train within that period of time before he gets to the crossing, which I understand, because the goal would be for the car to get out of the way, not the train to stop. That's the goal, but that's not always the end result, unfortunately.
Right, and with various speeds throughout the territory, that becomes much more challenging, but you would be stopping trains all the time at that point, and really not doing anything to improve that situation. Vehicles are trying to get around gates. They're trying to beat the gates.
Right.
You'll have in two-track territory or three-track territory, you might have a common occurrence is trains meeting at a grade crossing or anywhere, but sometimes at a grade crossing. So you've got gates that activate. Gates sometimes start to come up. Cars want to get through before they even rise, where the lights stop, and another train is coming and activates. So there's constantly cars and movement going.
And that's very prevalent where the crossing is close to the platform.
Yes.
Because the train stops to let people off and put people on. The people get off, and they assume they can now cross the crossing, or the train, the cars backed up have been delayed, waiting, and then the other train comes, and then they have to wait again, which only exacerbates their lack of patience in this regard.
Right. So it's a combination of education in those situations and looking at technologies that may help with and reduce the likelihood of the gate bobble going up and down in between trains as train meets.
Right.
You want something electronic which alerts the driver that they can't join the queue after a certain number of cars are in the queue because they'll endanger themselves.
And there is that, and we're looking at that in some locations where, depending on the distance between a traffic signal where there is preemption and that line of cars, depending on that distance, sometimes you need that to identify to the traffic light that's the case. Yep.
To some degree, we need for cars what we have for school buses, which is the school bus is not allowed by state law to go across the grade crossing without stopping first and ensuring that they can get across to a safe area on the other side. That's basically what we would need for cars. Now, I understand that's not always appropriate, but in many cases it would be very appropriate.
But it is the law would block the box, which is no different than this. You're not allowed to enter an intersection unless you can go completely through it. Not very well followed by drivers, and I haven't seen it enforced in years.
Right. That's the problem.
We actually did some work with New York State Department of Motor Vehicle as well, and enhanced their driver test with some specific questions about grade crossing safety. So as of this year, the 2017 version, there are grade crossing questions on the New York State DMV driver test. Yep.
And if we could only give that test to everybody who lives in the suburbs, we'd be very good at the moment in that context. The one other question, and I raised it at the Long Island Railroad Committee meeting the other day, is obviously the number of grade crossing incidents has gone up. It's almost doubled, at least on the Long Island section. And I assume we're looking to see where they are and is there any pattern of issues. And I know, Pat and I have talked about the issue of the GPS issue, sending people on the train tracks because they assume that's where you make a right turn. And I know that was a contributing factor in a couple of the issues. How are we working on that issue and any others that we found to be a pattern?
I'll just mention one thing and then certainly let Lori speak to the specifics of Long Island. But generally, one of the things that is happening as well on a federal level, the FRA is working with Google and Waze to introduce grade crossing icons and warnings in their applications, so that as you're approaching, there'll be a warning or an icon or a combination of that in that application as you're approaching a grade crossing.
An important part of GPS. There are multiple different providers of GPS depending on the car make or handheld devices, but lately all of them will tell you when you're approaching a red light camera to give you a warning. They could easily do the same thing in this particular case, and we need to do it because, Mitch, I was in Mineola when a fellow drove right onto the track, and I had the opportunity to actually talk to the guy, and like, what happened? And he said, well, the GPS told me to turn here. It's a scary concept. I mean, so we need to. Well, what we are seeing more and more accidents away from car accidents, where people are all claiming, well, I was looking at my GPS. It's a problem.
Increasingly, motorists really do follow turn-by-turn directions, and Google and Waze, like Ann mentioned, that's really the same company now. They are very interested in piloting some technology that would incorporate knowledge of railroad crossings, and I believe Bridges and Tunnels reported in a prior safety committee meeting we actually have partnered with them, and we've indicated our willingness to continue and extend that partnership to grade crossings. Sorry.
Google has an interest in this that goes beyond their own GPS. They now are leading the world in driverless cars, and the last thing in the world they want is that driverless car to drive onto a track.
That would be the last driverless car there is.
Right, that single point of failure for an entire investment. Right, can go.
No, just to build on that, so we're really focusing on data-driven decision-making, as you said, when we're looking at these different events, but we're also looking beyond that. For us, the broken gates is a precursor, and that's one of the things that we report on as well as one of our metrics. Education, because we talked a little bit about some of the engineering solutions, but education and enforcement are also critical elements of grade crossing safety as well. So working very closely with the MTA police, every month we share data about where the broken gates are so that they can then increase their enforcement efforts and really target those locations where there seems to be an increase in that type of activity. So enforcement and working collaboratively with the police is one aspect of our intervention. We also partner with the police on the tracks in the Operation Lifesaver program. So again, using patterns of both broken gates, reports from our locomotive engineers of when they see that at certain crossings there seems to be different activity from pedestrians and drivers. We use that data also to inform our strategic outreach. So going in and doing those presentations, going out to the grade crossings, and we're also taking the initiative to paint lines, similar to what you saw with the delineators, because as you said, Mitch, a lot of the events that we're seeing are because either a driver's not familiar with the area, their GPS tells them to turn, it's dusk or it's raining out, so don't quite have their bearings. So we're trying a number of different strategies. We also have now currently running on all the radio stations as well as in print advertisement, changing the message again, don't race for the gate. So again, trying to promote the awareness, because obviously our grade crossings are infused throughout. I mean, the communities on Long Island grew up around our system, so we were very conscious of that fact.
understand, nothing is foolproof, but at least that will provide a better aspect of where people should go. That would be something I think we should, to the extent we can, move that along at our process quicker than the review of the technology.
And that is being done at many of the grade crossings as enhancements are made. One of the things that's critical with that is working with the roadway, the owner of the roadway. So sometimes it's a local municipality, sometimes it's a county, sometimes it's state DOT. State DOT by far is a wonderful partner, and they've embraced all of these enhancements and are really helping us with them, and as well as the local municipalities and the counties. It's a little bit more challenging because it affects their budgets potentially. There's maintenance if they get torn off. Typically what we're doing is we're buying them and helping them install them and then asking them to maintain them as they move forward. So there's that challenge as well, as just getting them to take on the ownership of maintaining some new devices on their roadways.
Okay. If there are no further questions, our next presentation is about sleep apnea. David?
Yes, so I'm going to provide an update on obstructive sleep apnea, what we're doing with our screening and treatment program. The intent of this presentation is to kind of close the year out by providing you information, statistical information, on where we stand in the program, to include how many diagnoses have been made so far. But I want to do that in context rather than jumping to that. So I put together just a couple of slides to kind of review what the program is and how we're monitoring compliance, and then we'll jump to that. So to start out with, just as a reminder, there are not any federal rules or regulations or guidelines that really guide us in this program. This is very much a program that we are inventing and leading the way on, and I think quite honestly very successfully so. And so I would mention, although Dr. Lim and John Chrissy from Occupational Health Services are not with us this morning, they have come to prior safety committee meetings, and they are the real engine behind getting, they and their staff, behind getting the screening done. So I just give a shout out to them as we kind of review a little bit of the program. So we can move on to the next slide. So you remember that obstructive sleep apnea is a condition in which someone stops breathing overnight multiple times, and it leads to excessive daytime sleepiness and the propensity to fall asleep involuntarily. There are a bunch of risk factors that we've reviewed before. They all revolve around gravity and middle age, and are common in men. It really is a gravity problem. The airway is just simply compressed during sleep. It shuts off breathing. So those are the risk factors that we're concerned with. And the next slide will show that there are, even though they're not federal guidelines, there are medical standards for how to evaluate someone for the risk of sleep apnea. So we have trained all of our physicians in a continuing medical education unit and provided them the tools so that they can screen uniformly and apply the criteria across our population of employees who are subject to screening. So our staff physicians perform the initial risk assessments, and then for anyone who's deemed to be at risk for OSA, they're referred to a sleep specialist, a sleep clinic, for further evaluation, for a sleep study to diagnose whether they have sleep apnea and to determine its level of severity. So if someone is referred for that sleep study, that person may choose to use one of our contract vendors. We encourage them to do that, because if they use one of our contract vendors, we hold our vendors accountable to certain timeline standards that are more rapid than they may find if they choose to go with their private medical provider. But obviously we can't control where they seek medical services, so they may choose to go the private medical route as opposed to one of our contract providers. Either way, they can get competent care. So what happens if an employee receives a sleep apnea diagnosis? So the employee is required to follow up with a sleep specialist and work with either his or her private medical doctor or our sleep vendor to become compliant with the treatment program if one is prescribed. And just the final bullet up there kind of reminds us all that although this is a mandatory program for those job titles that are required to participate in it, it is part of an overall health and wellness program, because sleep apnea is associated with a number of other medical conditions such as hypertension, diabetes, and cardiac problems that will also be ameliorated if sleep apnea is addressed. So If an employee receives a diagnosis of obstructive sleep apnea, there are really a wide variety of treatment routes available, but there is the most common, and that is CPAP, continuous positive airway pressure. That's a mask and a device that essentially gently forces air into the employee or the patient during a sleep period to make sure that apnea events, not breathing events, are minimized. There's good research out there on CPAP usage. Its usage does reduce crash risk in commercial truck drivers, so there's no reason to believe it wouldn't reduce crash risk in bus operators, locomotive engineers, and train operators. And in fact, just as little as one night or one sleep period successfully with CPAP treatment has been shown to completely relieve daytime sleepiness. For the most part, CPAP is used for moderate to severe sleep apnea. Those with milder cases can be treated with an oral appliance. Regardless of what the treatment mechanism is, we require that a memory chip or similar technology be involved or be included so that treatment adherence, treatment compliance can be monitored. So what exactly is treatment compliance? So treatment compliance is defined as a use of 4 hours per sleep period on at least 70% of the days in the 30-day look-back period for any review. That's not invented here. That's actually a medical standard that was recommended to us by a panel of experts that were retained to develop medical standards for New York City Transit, and it's consistent with a medical review board that was convened a couple of years ago by the Federal Motor Carrier Safety Administration when it was pursuing, although unfortunately it no longer is, when it was pursuing regulations on sleep apnea for commercial motor vehicle drivers. So how do we verify compliance or adherence with the treatment program? So we tell employees that they will be required within 90 days of receiving a diagnosis to provide certain materials to us. They need to provide a report of their diagnostic sleep study and any evaluation done by a sleep specialist that contains the diagnosis and records of any treatment that had been prescribed, and of course the 30 days of compliance data. That data can come to us either in paper documents or in the memory chip. So show pictures of that there. So how do we actually verify compliance? Each of the medical facilities across the MTA has a database of medical records, and compliance is tracked and documented, and when our medical professionals require further documentation, they communicate with the employee, who will either supply it directly or through their physician. So assuring compliance, our clinicians will evaluate the materials that are submitted and determine whether or not there is compliance. You can imagine this is a medical diagnosis of actual real people, and the diagnoses vary from low, moderate to severe. Different folks have different levels of ease of compliance, so nothing removes clinical judgment from our clinicians who may require these employees to be seen more or less frequently based on their clinical needs and their success with treatment. Employees who do not provide the required documentation are at risk for being placed on restricted duty, to being held out of service from passenger train service. So that is, much as this is all about their wellness, it all is about safety as well. And if they don't provide the necessary information, they are at risk for being held out of service. And so finally, I think we get to the numbers. So as of November 30th, here's how it breaks out. We have screened, we've risk assessed in our clinical facilities about 9,729 of the employees and the job titles that we're currently working through. Just over 2,000 have been reviewed for diagnostic sleep studies, and if we refer you, we believe that's because you're at risk for having obstructive sleep apnea. And as of November 30th, we have 1,185 employees who we have essentially enrolled in our treatment adherence monitoring program to assure that they are in service and compliant with treatment. And about 184 employees across the services have been, across the agencies, have been placed into a non-duty status or restricted duty status due to non-compliance with therapy.
The 9,729 figure, what percentage of all of the employees that will need to get tested does that represent?
It's about 55%. We're working toward working through all of the employees in that first tier of risk by about May of 2018 is our goal.
Which categories are we testing in from job categories?
So the specific titles that we're reporting on here are bus operator, train operator in the subway system, and locomotive engineer on our 2 railroads. Forget anybody? Oh, conductors will come next. They're actually, because all the locomotive engineers have been screened at Metro North has moved on to conductors, but conductors are next or down the road.
So the intent is
the others.
by May, everybody who moves a vehicle will be done.
The intent
That's
is
the
by
goal.
May, the job titles that I first mentioned, the locomotive engineer, bus
Right.
operator, and train operator.
Will be done by May.
That's the goal.
Okay.
And we're talking work vehicles as well?
That's next in the pipeline. So we've kind of divided the risk into a couple of different tiers, and the job titles that I've mentioned now twice are the first tier, and that's really where we're focusing on, and those are the numbers I reported. Even though we are screening conductors at Metro North now, I didn't include those in there. That's it, if there are no questions.
Any further questions? That concludes our meeting this morning. Our next meeting is going to be in January 24th. I'll entertain a motion to adjourn. Seconded. All in favor? Aye. See you in a little bit for the full board meeting. 45 minutes. Wow.
I was really thinking the university would run late and we'd be compressed.